Before we start this episode, I want to extend a powerful invitation to you that, if you accept it, has the ability to change your entire life. This January, in a new year with a fresh start, I invite you to join my Build Her Legacy Mastermind. This is for the woman who needs clarity and is ready to commit to the blueprint that builds a wealthy life and a legacy worth passing on. This is an 8-week restructuring of your life, your money, your identity, and your future. Most women are trying to build the life they want on top of shaky foundations, unclear about what they truly desire, disconnected from themselves, and unsure how to make money work for them in a way that creates true financial independence. My friend, inside this mastermind, that changes. You will examine your beliefs, your patterns, and your internal narratives. We strip everything down to the studs and rebuild you, because sometimes we have to unbecome who we've been in order to become the woman we're meant to be. You will learn what true financial sovereignty looks like and how wealthy families build, protect, and pass down their assets tax efficiently to the next generation. We will unpack the wealth principles and assets no one teaches women, and we will rewire scarcity, fear, shame, and confusion around money. And we're going to integrate health and wellness practices that support the life identity you envision, because you cannot step into your power if your energy is depleted and your belief system is working against you. My friend, we start January 8th. This is your moment to stop living by default and start living by design, to stop wishing for freedom and start creating it, to stop hoping for one day and start building the blueprint today. This is the foundation your future demands. This is the beginning of your wealthy era. If you're ready to accept this invitation, or if you have any questions, DM me the word legacy on Instagram or click the link in today's show notes to reserve your spot inside the Build Her Legacy Mastermind.
This isn't just another podcast. We're crushing the taboos and we're rewriting the rules. It's the space where we normalize women becoming wealthy. If you're done playing small and ready to become the CEO of your life and the architect of your future, then my girl, you're in the right room. Welcome to your wealthy era. Welcome to the Wellthy CEO podcast.
In this episode, I sit down with a doctor who has spent over 25 years doing what most doctors avoid, finding the real reason people stay sick. Dr. Shiva Lalezar is a pioneer in functional medicine, specializing in root cause healing, hormone optimization, gut repair, and heavy metal detoxification. If you've ever felt like something was off in your body and no one could tell you why, this is the conversation that's going to change the way you listen to yourself forever. I am really excited to introduce and welcome Dr. Shiva to the Wellthy CEO podcast today. Thank you so much for being here.
Thank you so much for having me, Shae.
And you're on the West Coast. I'm on the East Side. And so this is really amazing that we can be able to have this conversation today. And I know that you move from conventional medicine into root cause functional medicine, which still, even that phrase, not a lot of people are familiar with it. They are more now than they were 5 years ago, but it's still, some people go, what is that? Before we get into the good stuff about what your work is and what you're the expert in, I would love to know, what was like your turning point? Like, let's just talk about your story a little bit around what made you want to make this change or go into functional medicine.
Yeah, I think I was really blessed because when I was 18, my older brother took me to a naturopath. I was at the time 20 pounds overweight. I had acne. I would have definitely been diagnosed with attention deficit disorder. But this naturopath actually tested me for food allergies, and I was highly sensitive to gluten and rice. Eliminated those two, lost 20 pounds in 2 months. My acne cleared up, and my focus increased dramatically because all the inflammation that was going on in my brain disappeared. I graduated, with honors from UCLA. And I decided to go to medical school and residency and kind of continue his work. He became my mentor. So when I came out of residency, I already had 10 to 12 years of, a lot of learning with Dr. Jerry Stavish, who was my mentor. And he was sending me all these incredible thick books. And I was learning this world of prevention and integrative medicine and functional medicine while I was going through medical school and residency. Then when I came out, I, studied functional medicine. I became certified in chelation therapy. I studied spiritual psychology. I also, joined ACAM, which is American College for Advancement in Medicine, and American College and anti-aging conferences. So A4M,
Amazing.
American Academy for Anti-Aging Medicine. So a lot of training, even post residency, and I've been practicing this type of medicine for the past 20 years.
Yeah, which is so incredible. And, as you know, with Western medicine in general, it's put a band-aid on the symptom as opposed to looking at what the root cause, like, why do you have this issue? And so many people don't think past that or even realize, like, you actually don't need to live in some circumstances, not all, of course, but in a lot of cases, you can actually get to the root problem and solve that and not have to use medication or keep medicating to just put a band-aid over whatever your health issue is. Correct. And so let me ask you, what do you see? Is there a pattern? Because you've been doing this for a long time, over 20 years. Is there a pattern that you see often in women's bodies that you can tell instantly that they maybe be carrying more than they even realize or that they want to admit?
Yeah, in both men and women. I think the reoccurring theme in everyone that I see is inflammation. People are just swollen and they don't know it. And they're swollen at a cellular level, and their cells are not communicating properly. Now, that could be due to many different reasons. It could be due to leaky gut. It could be due to heavy metal toxicity, environmental toxins. It could be due to hormone imbalance. Um, it could be due to all of the above, right? So, what I do in the practice is I spend a lot of time and pay a lot of attention to that remove part of the protocol in functional medicine, because there are 4 R's in functional medicine: remove, replace, re-inoculate, and repair. I always tell my patients, I'm not going to be able to get anywhere if I don't do the remove part of the protocol. And even with holistic doctors and functional medicine doctors, the flaw that I see in some of the protocols that are written is that you give these patients 30 to 40 different supplements trying to repair the system, but the first R of the protocol, which is the remove part of the protocol, has not been addressed. If a patient is full of, like, mercury, for instance, or lead, if a patient has a mercury level of 110, doesn't matter how many supplements I throw at them or how many IV drips they get, like, let's say vitamin drips, they're still loaded with heavy metals. We got to pull that out.
So, I mean, so many people are living with, and it's funny that you identified saying inflammation. I just actually did a colonic this week. And, for those that maybe don't know what that is, it's cleaning out your colon as one of the ways of exactly what you're just saying, like removing. And I am 11 months postpartum. And so, you shouldn't really do them, obviously, like while you're pregnant, especially like after your first trimester. Like, no, I didn't do them at all while I was pregnant. And so, I used to do them every like 3 to 4 months as just like regular maintenance. And so I had actually said on my Instagram that I think I'm gonna have a lot of mucus, which is an inflammation indicator, just because of how I'm feeling in my body. And of course, I had like all this mucus come out, like my acidity levels were like yellows high. And so as a removal, or like, what are some of the, and we were going to get into the chelation, but what are some of the tools to be able to remove that maybe most people don't have any idea that they should be integrating this into a regular basis into their health routine?
I mean, It's very important to avoid the environmental toxins to begin with. For instance, if you're eating a lot of high mercury fish like tuna, king mackerel, sea bass, cod, catfish, orange roughy, swordfish, those are large fish that accumulate a lot of mercury in their fat cells. It's best to avoid eating those fish. Just that can definitely over time elevate the mercury level. If you're in an old house with old paint chips and old, piping like lead piping, the water source is a big deal that can raise your lead level. And quite often I see high lead levels actually with patients who are coming from back east, um, because the structures are much older back east. Um, aluminum containing deodorants, which is right next to the lymph nodes of the breast. It's been associated with breast cancer. I would definitely say stay off of aluminum containing deodorants. Cleaning detergents at home are full of toxins. Stay off of those. Use just water and vinegar to clean. Even like those dishwasher soaps now, there are cleaner ones that have come out that's not wrapped in plastic. Plastic is another issue. Try to avoid warming up food. I don't even use microwave anymore because that's also right, right. Don't use plastic containers. Don't use plastic bottles because we're just loaded with xenoestrogens. Those are synthetic estrogens that we can get from the environment. Many women that I see are estrogen dominant. You mentioned postpartum. One of the reasons that women after delivering their babies, they're feeling depressed and they're not feeling good is because all of a sudden the progesterone level drops and they're loaded with estrogen still. So that estrogen to progesterone ratio is off.
Right.
And estrogen dominant symptoms can be breast tenderness, irritability, sugar craving. You feel like you're coming out of your skin, and severe depression. Those are some symptoms that even women who are not postpartum could have, and it's being missed. And a little bit of natural progesterone can turn these women around. Um, you know, PMS patients, like, let's say teenagers who are estrogen dominant and they're having severe PMS every week. They're going through 1 to 2 weeks of hell and they're not feeling well. They're coming out of their skin. You give them a little bit of natural progesterone and you can turn things around pretty rapidly within a month or two, actually.
Well, and you would know this better than me as you're saying this, like specifically for women. It's something like by the time a woman wakes up and leaves her house, like meaning like she just showers, putting on her skincare routine, makeup, it's like she's exposed to 75 different toxins and chemicals. It's like some crazy number like that. And so many people you don't think about like the shampoo, the conditioner you're using, what you're washing your body with, which is our largest skin is like your largest organism, like, that your surface that absorbs absolutely everything. And they're
Correct.
very, women are putting on a toner and then a serum and then a cream and then the foundation. It's like layer after layer after layer that exactly what you're talking about can really add and contribute and spike the estrogen levels along
Correct.
with the toxins.
And obviously there are a lot cleaner products nowadays than let's say 10 years ago. So it's very important to pay attention to that.
And when you think of maintenance of the body or like doing a detox, and there's many different things you can be doing to try to start to clean out your body. And I'm sure you would agree with this. The idea is to remove the toxic load from your household and your lifestyle. Because if you're detoxing and you're not making any external changes and you just keep putting it back in, it's kind of like, what's the point? Like, better to do something than nothing, but you're going to still have the same issues because you're not making any lifestyle changes around that, right? So if somebody is making those changes, they stop drinking tap water, they're having proper, and not just like a Brita filter water, like a proper water system. So they have high quality water, high quality pH levels, makeup, food, like you said too, the detergents, they're washing the pucks for the dishwasher, what would you say should be mindful, like, detox in the year? Like, how many?
N-acetylcysteine is a supplement that's a precursor to glutathione. That's a great way to clean up the liver. The liver has two phases of detoxification. Phase one, most of these toxins are fat soluble. So, in order to make them water soluble, you want to add a sulfur group to that toxin so that you can actually pee it out or poop it out. So glutathione is a fantastic way to clean up the liver and to clean up the system. N-acetylcysteine, if let's say patients don't have access to IV glutathione, I would say NAC is a good thing to be on, or glutathione sublingual to put under the tongue is also a good thing to be on. But if you have access to IV glutathione, I highly recommend it because one or two IVs a month can do wonders in terms of, adding that sulfur group to the toxins, and then peeing it out or pooping it out.
So, one of the reasons I was really excited to talk with you is you are a chelation expert. And I'll be honest, I did not even know that there was a word called chelation until about 3 years ago. And I'm pretty good in the health, chemical free, toxic free, like, realm and world, and it was still new to me. And so I would love for you to share, like, number one, what is chelation and what's the purpose of it? And then we're going to dive into that side a little bit.
Sure, sure. Well, first of all, chelation has been around since World War II, when soldiers were coming home and they were loaded with lead and mercury and arsenic. In the hospitals, they were getting IV chelation. So chelation is not a new concept. It's been around for a long time. Unfortunately, it's not as available to everyone because the compound of risk, so the pharmaceutical companies didn't really invest much money to making it pharmaceutically available. Otherwise, all the doctors would have been doing chelation right now. So only a few doctors who are trained through ACAM, American College for Advancement in Medicine, and they're certified in chelation therapy, they are doing IV chelation therapy. Chelation comes from a Greek word claw. So these chelating compounds have a claw-like structure. They act like a magnet. And we have different types of chelating agents. The ones that I use in my office is called DMPS, and another one that I use is called sodium EDTA. DMPS, and I give these chelating agents through the IV. So it's an IV process. The DMPS chelating agent goes after mercury and tin, and the sodium EDTA chelation goes after lead, aluminum, cadmium, nickel, and gadolinium. Depending on what I get with the urine tox results, and that is really the best way to actually test for heavy metals is get the proper provoking agent, whether it's DMPS or sodium EDTA. And I don't like to give them at the same time. I have patients come in on separate days. So I give them the DMPS, I follow it with IV glutathione. They go home and collect their urine for 6 hours. And then we see exactly how much mercury and tin came out. And based on that, I will order a number of chelations for them. And they come in once a week and they do the chelation. Within 5 to 10 weeks, generally, they're done. There are some patients that I had to do 15 to 20 chelations, right? Then I have them come back and do the sodium EDTA to see what other metals they have, like lead, aluminum, cadmium, nickel, gadolinium. And then based on that, I will prescribe whether it's 5, 10, 15 chelations. Before I got pregnant with my twins, they're 14 years old now. Before I got pregnant with my twins, I chelated myself. My mercury level was 57. You should not have any mercury in your system. And I didn't want to transfer that mercury into the babies because it can get crossed through the placenta. So what I did was I just did 15 chelations and brought the mercury all the way down before I got pregnant. There are a lot of OBGYNs in town that are referring their patients to me so I can chelate these patients before they get pregnant. Even when they're doing IVF, I get referrals because these women want to get the mercury and lead out of their system before they do IVF. The egg quality improves dramatically when you pull these toxins out. It really causes havoc in the system and people are not aware of it. Generally, after second or third IV, their brain fog and fatigue lifts. And a lot of the body ache and joint pain goes away. Inflammation goes down dramatically, even after third chelation. We're just working right now in the office. We're working with a patient with severe dermatitis, eczema. Her mercury level is 110.
Wow.
And all she has gotten from different dermatologists has been prednisone, prednisone, prednisone. And you can imagine what that prednisone is doing to the adrenal glands. But her case is so severe that she needed the prednisone. So I'm not poo-pooing the prednisone, the situation. She needed the prednisone to calm down the inflammation, but the prednisone is not getting rid of the mercury. The prednisone is not getting rid of the root cause of the problem, which is the mercury here in this case. She also has severe leaky gut. So all those antibodies and the antigens are leaking out of the lining of the gut and it's attacking the skin, causing inflammation in the skin, hence the dermatitis and eczema.
And when you do the chelation treatment, is it like, I know you separate it a week apart, but do you have to be waiting a week or that's just like the best practice protocol you do?
If patients are constitutionally strong enough and they can handle the chelation, they're more than welcome to come twice a week. So this particular patient, I started her with 10 chelations. She's going to come twice a week. In 5 weeks, we are going to retest her. I'm pretty sure we're not going to be done with 10 chelation because her mercury is 110. And I told her that, but I do want to test her again in about, 5 to 10 weeks. And her mercury level, if I were to guess, is probably going to come down to 40. And then I'm going to do another 10 chelations on her. But chances are that the dermatitis will completely resolve.
And are there similar or like common symptoms that you've seen that could be an identifier for somebody who has metal toxicity?
I mean, honestly, in my practice, it doesn't really matter what kind of symptom they come in with. I always tell them, allow me to test you. Hopefully, you don't have any heavy metals. But if you have it, I don't want to be the doctor who missed it.
Right.
Because most practitioners out there will miss it. I had a wonderful case that was referred to me by a gastroenterologist, a 27-year-old who had nausea for 10 years, and her mom begged the gastroenterologist, just check her mercury level in the blood. So the mercury level in the blood was 19. I got a phone call from the gastroenterologist. I want to refer this patient. I said, I will promise you that if the mercury in the blood is 19, at a cellular level, it's going to be much higher. And sure enough, her mercury at the cellular level was 90. We did about 10 chelation. Her nausea has decreased by 80%. This is after 10 years of suffering.
Wow. That's unbelievable.
Yeah. So it doesn't really matter what symptoms patients present with. There are 4 pillars in my protocol. Number 1 is balancing the metabolic syndrome. So if they're overweight, I am going to use GLP, GIP, like tirzepatide, to help them lose weight, get rid of the insulin resistance, lose the visceral fat, because that is causing inflammation in the system. Number 2 is heavy metal detox. Let's detoxify and get rid of all these toxins so that the body will have a chance to repair itself. Number 3, gut repair. Make sure the leaky gut has been addressed, SIBO has been addressed, stool test has been evaluated, clean up the gut, get rid of all the food allergens. That's number 3. Number 4 would be hormone optimization. In women, it will be estrogen, progesterone, testosterone, and DHEA. Sometimes cortisol, sometimes thyroid, depending on what the tests show. And in men, obviously, it's going to be the same, testosterone and DHEA with cortisol and thyroid. Not so much estrogen and progesterone. So honestly, if the patients go through this full protocol that I'm telling you, the 4 pillars, there is no way that their symptoms wouldn't disappear. and the whatever condition they're dealing with, most likely is going to go into remission. It's a common sense. It's common sense, right? You remove the triggers, you balance out the body, you give them the proper hormones that they need, you give them the proper nutrients that they need, get all the food allergens out of the body, out of the system. I mean, the body is going to heal itself. There's no reason why they should continue having these inflammatory processes.
I agree.
If something in this episode is hitting home, can I please ask you to take 30 seconds and subscribe to the show and leave a review? Share this episode on your Instagram and tag me. I would love to see who's tuning in, and your share might be the nudge another woman needs to start her own wealth journey.
And, you said the body wants to heal, and it's like that's how the body is designed, like it actually wants you to be healthy. It wants you to heal. And so if you're doing things to support that, that's what it's designed to do.
Yeah. And let's say your patients don't have, or people don't have access to this type of medicine. The first thing they need to do is an allergy elimination diet. Come off of inflammatory foods, come off of gluten, dairy, soy products, corn, um, sugar, lots of caffeine, right? Come off of those inflammatory foods, nightshade vegetables, add lots of greens, lemon juice, apple cider vinegar, alkalinize the blood, um, cut out the grains in the diet. And I tell you, even changing the diet, they're going to see 30 to 40% improvement in their symptoms.
And I'm sure you would also recommend trying as much as possible to eat organic so that it's not sprayed with glyphosate and pesticides and adding toxins and inflammatories to your body.
Absolutely. I'm so glad you mentioned that.
Yes. And it's difficult because, even like things that get sprayed in the air as well, it's like literally everywhere, and it can be really difficult. But, I share this actually a lot on my Instagram. 99% of all my food now comes from farmers. Uh,
Nice.
it takes a little work in the beginning, because you gotta find your people, get the schedule. Sometimes there's drop off, sometimes there's deliveries to your house. And it can be a little bit of overwhelming work in the beginning, but it is so worth the trade-off of just knowing, like, literally. And a lot of the reason I made this shift, because I was like 80/20 before. I was like 80% everything's organic, 20% is I'm still hoping it can be, but if not, it's not a big deal. Like, you try to live in balance, otherwise you can go a little crazy sometimes, right? But when my daughter was born, I was like, there is no way that this perfect, precious, healthy little thing is going to, when she starts eating solids like food, I am just not doing that. Like, I have zero tolerance for it. And so now, like, literally 99% of all my stuff comes from farmers. I just went today before our podcast, I picked up my eggs from the farmer, and they're all organic, nothing sprayed, all free range. They got to run around and be happy hens. And, like, this is so important when you think about what you're putting in your body, that it's not sprayed with really horrible toxins.
You just made me so happy because you honestly are going to reap the fruits of your own labor with your daughter. You're going to see that if from this age you're giving her such healthy food, when she gets to be the age of my daughters are now 14 years old, teenagers, they just don't want the junk. I mean, they went to a play date and the friend was begging them to have some hot chocolate, which was full of sugar. They just said that we don't want it. Like their body refuses to eat mac and cheese and fried foods and sugar. There's no way they would like have all this candy during Halloween because they just don't feel good when their body is so clean. But you make them a huge bowl of salad, they will finish it. They will finish it. And I'll tell you, because they were on this paleo diet from day one. From day one, they were eating very healthy, all organic. So I congratulate you for making that decision Because when they get to be teenagers and they're surrounded by a lot of junk food, you're going to see that your daughter is going to say, no, thank you. I'm not interested because her body is so clean and she doesn't want to mess it up.
Well, thank you, because that is part of the hope, like that when she gets older, she'll feel that. Like you said, when you eat something like that's quick and easy and accessible, like McDonald's or whatever, if you eat very clean and organic and healthy, it just doesn't feel good. Like your body, that's it's trying to eat plastic. Like your body can't break that down.
I think someone brought us donuts. I told them, just try a little bit of the donut. You can bite them. They were 5 years old. I never forget that. They took a bite and they spit it out.
Yeah. You know,
Like, no.
for them, it doesn't taste like real food.
Yeah, they didn't like it at all. So you're doing the right thing because, not to insult anyone, but I call it the trash can theory. My mentor used to use this analogy actually. If you sleep beside the trash can long enough, you're not going to smell it,
That's-
right? But if you go away to a garden of roses for 6 weeks and come back to the area where the trash can is, you're going to start throwing up. You're going to smell it. It's the same concept with food allergens. If you're eating a food allergen on a daily basis, you probably are developing oral tolerance and not realizing that that food allergen is causing inflammation in your body. So the antibodies and the antigens are attaching, right? Let's say you're having gluten sensitivity, but you're not realizing it because you've developed oral tolerance. Now I'm going to get the gluten out of the body for about a couple of weeks, and these antibodies are free floating, the immune system, right? Then you reintroduce the gluten, boom, you have a huge reaction.
Yeah. Yeah. Big time.
Yeah. So that's, yeah. So it's good to become aware as to what is the oral tolerance. Let's get that food allergen out of the diet, reintroduce it, and see what type of a reaction your body shows. And then after a while, you'll be like, I don't want to have this reaction. If I have a piece of pizza, my joints are gonna swell up. I'm not gonna do it. It's just not worth it.
Yeah. I love that. And as you're explaining the trash can theory, what was for me, yeah. So no, I love it. I'm going to start using it. I'm going to quote you on it. I'm going to start using it because it's such a good analogy. It's a very clear picture as to the reality of what happens with all toxins. Like I used to be, this is going back 20 years ago now. I really started my chemical free living, if you will. My journey started about 15, 20 years ago. But I used to be the Windex queen. Like I would use Windex for everything. Even though it's a glass surface, I would use it to clean the counters, to clean the bathroom. I used it for everything. And then as I started like learning about chemicals and airborne toxins as well, and like I was like, okay, let me get a natural cleaner. Little by little, it's an onion. Like there's a layer, and you can't make the major shift and do everything overnight. That's very overwhelming for a lot of people. But I tell people do one new thing a month. Like if you're trying to remove toxins from your household and your life, just change up one thing a month. And now, never mind just with Windex, but Windex or like perfume, those two things. I haven't worn perfume since I was 20 years old. I'm 40 now. I use essential oils. Here's what I put on before. This is my doTERRA vetiver. It's a good grounding one for my podcast that I like to use. If somebody walks by me wearing perfume, or like if I walk into somebody's house who has sprayed Windex or air fresheners, it hits me like a wall. Like I'm like, whoa, the chemicals in here. Like it's very, very strong. And to your point, the trash can theory, you don't even realize that you're smelling, but it's so beautiful. It's so true because it doesn't bother you at all. You're so accustomed to breathing in these toxins that you think it's normal. Like people spray perfume all the time on them. I'm like, you're spraying Windex on your neck. Like that's what you're doing.
Yeah, no. We even have a sign in the reception area that patients are not allowed to wear perfume in the office.
Love that. Yeah, because
Yeah, they're not allowed to wear it because, we have other sensitive patients in the practice who are getting IVs in here.
yeah.
And it's, It's better not to use it at all. So
It is.
yeah.
Yeah. But
The worst case scenario is when someone gets into your car. You have to drive them somewhere and we're stuck.
yes, or the opposite, if you get into an Uber and somebody has just left and you have that there too, so either in your car that's happened to me so many times where I've actually been like, I want to cancel this Uber and just get out because I can't breathe this for 20 minutes. Like,
Yeah.
it's so bad. Or I sit there, like this. It's trying to breathe myself. So it's people really don't realize it. And I love that you brought up the trash can theory because I think that's a really tangible takeaway that people could do today, whether it is with food, as you mentioned, removing inflammatories for your from your body for 2 weeks or a month, and just seeing how you feel. And then you could even read, you want to challenge the theory, and like you could have it again and see how your body reacts to that food or with Windex or perfume or whatever. So
Mhm.
yeah.
Yeah.
Um I think, and I know I asked you before about like symptoms because there's so many people that, and there's a long list. Like there's so many things, whether it could be like migraines, not sleeping well, having tremors in the body, which I shared with you offline. And, I'm happy to, I can bring this up, but my father had a snowmobile accident 4 years ago, had surgery. They put in a rod because he broke his femur in his hip. And he developed he started developing these little tremors. Like first you could notice it in his writing where it was like a little squish. And I could see it sometimes in his focus where I'm like, are you here with me right now? Did you hear what I just said?
Most of the implants are inert. Okay. They are not supposed, they don't have mercury and lead in them. I'll tell you what has mercury in it, and that's breast implant. Some of these breast implants have mercury in them. But these metals that they put for implants, they are supposed to be titanium and they don't have mercury in it. So we have to investigate and see where your dad got all this mercury and lead. I don't think it's from the implants. I don't think you need to worry about that.
Interesting.
Um, Cobalt, I have to look that up.
Yeah.
I would definitely investigate that and see what this neurosurgeon was, I mean, how would this metal actually start wearing off and give off cobalt? Definitely that can cause an immune reaction in the body because it's a foreign object. But it's not a heavy metal like lead and aluminum and cadmium and nickel and gadolinium and mercury. So I want to clarify that. What I do see with my breast implant patients who have developed breast implant syndrome is mercury toxicity.
Right. Which is that is a huge long list from inside joint pain, hair loss, inflammation, autoimmune disorder.
Oh, it's awful.
It's all kinds. I don't know if you know, but that's how Amanda and I met. I explanted in March of 2022. I
Oh,
al-
wow.
I had 2 sets over 11 years. And so, and I've shared my story many times. I had the Naked series on my podcast, and I interviewed many women who and sharing their stories because not all, all don't have the same symptoms, like all very different symptoms, and some of them are the same, but you know, they're just so different that when you start realizing, wow, she had insomnia and she had autoimmune disorder, and I got a whole bunch of red rashes. Like I would have these like
Yeah.
streaks on my body,
Yeah.
and I had inflammation in my body. But I also have very high stress levels and have a lot of like my cortisone and my adrenals are shot. So is it the breast implants or is it because of my stress? It's both, like they're both impacting the load in my body. But I didn't have hair loss. I have lots of hair. I didn't have those things where I had
Well,
had like clumps.
yeah, the symptoms are different in each individual. I mean, each individual manifests differently. But I do still highly recommend that you test yourself for mercury because even though the trigger is out, which is wonderful, you didn't that, the source is out, the heavy metals are still in the body. Like me, I replaced the amalgam fillings when I was, like 20 years before I discovered I had a mercury level of 57, right? But the mercury was still in my body at a cellular level. So many of, see, this is what drives me crazy, honestly. I've been reading all these articles about firefighters, how they're just like dying of cancer. And you see all these articles, all this news that comes out that this firefighter died of neurological disorder. This firefighter died of cancer. Okay, why isn't any of these articles, are they going to talk about chelation therapy? No, they don't mention chelation therapy. They're talking about heavy metals. They're saying that it's the environmental toxins from, right, the fire. The plastic surgeon is getting the breast implant app, but the next step for them should be referral to a doctor who's doing chelation therapy to pull all the heavy metals out.
Yeah.
You understand what I'm saying?
I know, I do. And it's interesting that you said that because, well, when my brother just became a fireman. So I'm like a year ago, literally, no, I'm telling you, I'm like, Amanda, she introduced us and you're like a godsend for like my whole family. So it's funny as you're talking, I'm like, I need to talk to my brother. My brother needs to be very mindful about chelation. And
Or policemen are loaded with lead because of the gun
sure, right?
and the bullets.
Yeah.
Yeah, loaded with lead. Mhm.
But you are right. Like my surgeon did not have an extraction protocol post my surgery. I did one for myself for 6 to 8 months because I know that like the toxins and it's a carcinogen and a neurotoxin that's been cooking in my body. Like there's all kinds of horrible things happening, right? But I've never gotten myself tested for mercury. And when you were sharing about your twins, I'm like, oh my God, please, please let my daughter be.
Oh, please don't worry. You please. Please don't worry. Really, the purpose of this podcast is not to worry people and to scare them. There are pregnant women here that say, "Oh my God, I should have chelated." I'm like, you know what? We're living in a toxic environment. The baby's gonna survive. Nothing's gonna happen, right? We're just,
She's good. She's healthy. She's strong.
yeah, she's gonna be just fine. She's gonna be just. Don't have the mother's guilt because no matter what we do, we are always gonna feel guilty.
Totally.
Um,
And it is part of what drove me to my decision to remove them then. Like I gave birth to her in 2024. I removed them in 2022, knowing that one day I hope that I'd be able to breastfeed because we obviously if a woman can or cannot. And there's for me personally, and I always say there's no judgment for any woman that makes a different decision, and many make the decision without realizing the toxicity that they are for the baby. And even with what you just said, this isn't to hear it and then be really scared and freaked out because maybe you're breastfeeding right now with implants. And that's not the purpose. It's, information and knowledge is power. And then what you do with it is even better. Right. And so it's about making when we know better, we can do better. And that's really what this is about. And I did that in 2022 knowing that maybe one day I'll have a baby and maybe I won't. But that was one of the decisions that I was like, I need to give my body enough time to heal and cleanse before I would host a little one in my body. And then if not, this is still my temple. I only have one. This is it. And I want it to be the healthiest version. And if I am really serious about chemicals and toxin free living, then why do I still have these things in me? Like they gotta go. So that was the simple, hard decision that I had made.
and this is the same concept with amalgam fillings, those silver fillings that have mercury in them.
Yeah.
It's wonderful to replace them, but even after you have replaced them, the mercury is still at a cellular level. So it's very important to chelate the mercury out.
Interesting.
And once you chelate it out, you're going to be good. Like I did this 15 years ago and my levels are still low. You know what I mean? It's not like you have to do chelation all the time.
Sure. Yeah, you're just now mindful of like you brought up a whole list of fish. It's like be mindful of how much you're eating. Even Tony Robbins, right? Tony Robbins, that's all he used to eat was fish. And it practically killed him because of the mercury that was in his body. And it's not that he can't ever have fish again, but don't have it every day, 3 times a day, or even every week. Like, enjoy it a couple times a month. Be mindful of where you're getting your food source from, you know.
And smaller fish like trout, whitefish, um, those are safer because they don't accumulate as much mercury in the cells.
So, Dr. Shiva, tell us if, this whole chelation is new to somebody, and you had shared with me about being a chelation agent. Like, how do you find the right person to be able to go to? Because part of it is physical, right? Like needing to come into like your practice. So if you're not in California, what would you advise to people of to how to find the right person?
Sure, sure. So the best website that you can find physicians who do chelation therapy is ACAM,
Okay.
.org, which stands for American College for Advancement in Medicine. Now, some of the doctors on there chelate, some don't. You have to make sure you go to a doctor who specializes in chelation therapy. If they're in Los Angeles, they should definitely come to me because I am an expert in chelation therapy. So, they can call my office or go to my website and come and see me and I chelate them. But acam.org, you will be able to find a doctor who will do chelation. Now, some of the doctors who do chelation therapy, they don't follow the chelation with IV glutathione. I highly recommend that you request that about 1,500 to 3,000 milligrams of IV glutathione is given after each IV chelation.
Okay.
Because we remember what you said at the beginning of the podcast, you don't want remobilization to other areas of the body. And glutathione will make the toxins water soluble so you can kick it out.
Yeah. Smart. Which makes sense to be able to do that. Anything else you would love to share just kind of in closing that you think would be like important for people to be aware of?
I think we covered a lot, a lot. Like I said, the 4 pillars: get rid of the metabolic syndrome and inflammation, clean up the diet. Number 2, clean up the gut, get rid of leaky gut. Number 3, get rid of the environmental toxins. And number 4, optimize your hormones. Because honestly, this is not just about today's symptoms, it's about how we are aging. 10, 15, 20, 30 years from now, do we want to be fragile, fall and break a hip, have lots of wrinkles and have memory loss and have muscle loss? Or do we want to age gracefully? So it's not that we are anti-aging. All of us are going to age. I was having a conversation with my mom and she said, it's inevitable. All of us are going to age. The question is, how are we going to age?
Yeah. Yeah, it's true. And it's I came back from Mexico. My daughter was 2 months old. We took her to Mexico for her first trip. And when we landed back in Toronto, I started crying because I was thinking about when she's my age, will she have children? And then it hit me that when she's 40, I'm going to be 80. And if she doesn't have children, even if she does, I'm going to be 80. I'm like, I want to live to 120 because I don't want to miss anything. I want to be there for her. And I did. I had this full meltdown crying. And so I share that story because of it just highlights the importance of what you said. Like, our health is so important, and how we age. We have a choice. We have the ability to age gracefully, to age strong, healthy. I mean, you see those people who are happy and not stressed. Stress is one of the number one killers, as you know, and makes you age quicker. But in supporting all of the 4 pillars that you had just mentioned again and recapped, doing all of this in combination, we have the ability to really live well and live strong and live longer.
Yeah,
Yeah.
wonderful.
Thank you so much for coming on today. I'm so grateful to have this conversation with you. And we're going to put all of your connections in the show links. So give Dr. Shiva a follow on Instagram. You guys are on there. And if you're in California, absolutely, there's nobody else to come and see but you. I'm even thinking I'm just going to fly out there. That's why I was asking, how many chelations do you have to do 1 week apart? I'm like,
You know, I I do have a lot of patients from out of state who fly in. I test them, I write them the full protocol, and then we'll find them a doctor that would implement the protocol in their town.
Amazing. Yeah.
Or even do a phone consult, so I can get the protocol written, make sure that it's done correctly, and then we'll find a doctor in your town to actually implement the IV chelations. But thank you so much for having me. I really enjoyed the podcast. You asked really good questions, and it's been a pleasure to be here with you.
Thank you so much.
Thank you.
If something in today's episode resonated with you or sparked a shift, tag me on IG or send me a DM. I genuinely love hearing what lands for you. And if it spoke to you, share it or leave a quick review. It helps more women find this show and step into their own wealthy era. Until next time, lead with purpose, live with intention, and stay wealthy.